All right, moving on. Now we're on to disease and disorders. This is a two-parter. You're going to need to know. I've kind of grouped them together. So these are all ones that basically involve coughing. Um, Influenza is a contagious illness that affects your respiratory system, obviously, and it's normally caused by this influenza virus. And so you get your normal flu. Most of us have it. It causes a bunch of extra things. The thing more unique about the flu versus the cold is this problem with uh, it doesn't just affect your respiratory tract. There's also this nausea, vomiting, diarrhea, muscle aches, this area where we're getting out of the respiratory system, which all of this deals with, and we're going into other systems and having negative effects there. So it's an important difference. Tuberculosis is a infection of a very, very tiny, called a microbacteria. And basically, because the bacteria is so small, it can travel on very small respiratory droplets, and the disease can spread very, very easily. We have multiple medications at this point to treat tuberculosis, but it is one of the most communicable diseases that we know of. And it not only does it have a negative effect on your overall health, but it literally destroys tissues. It creates these lumps of dead tissue inside of your lungs, and that lowers your amount of air you can move in and out. Um, Coryza or coryza is also known as the common cold. This is what we're dealing with right now. This is one of many viruses. Either it's a rhinovirus. A rhinovirus is a virus that affects your nose. It's a very common circular virus. Or the what we're dealing with right now are coronaviruses. Coronaviruses are a type of virus where the little fingers that viruses use to touch and hold on and grip and tear open your cell membranes, in this case, they're formed in this ring that goes on top of the circle like a crown. And so, corona, crown. So, these are crown viruses, and these are just the first viruses we found in your nose. So, they're named after rhinos. But a cold's basically a cold. And that's the weird thing about this coronavirus is this is a new type of cold. And this new type of cold is causing immense damage to the respiratory tract, and that's getting us to have the symptoms of coronavirus right now are dry, um, upper respiratory coughs, and that can eventually lead to more and more damage. And again, notice that unlike your flu, there's no problems here with your digestive tract. And so that's one of the key things to notice the difference is if you're not having any of that nausea or diarrhea, any of those lower digestive system problems, then it's not a cold. You probably have the flu. And so just an important difference between the two of those. So when people were getting ready for the coronavirus by buying a bunch of toilet paper, they misunderstood that this is not a flu like the Spanish flu. This is more of a cold type of a virus, which isn't going to cause those digestive system symptoms. There we go. I got it out. I got it out. The bigger problem with all of those is they can lead to a problem called pneumonia. So, any of those illnesses we talked about can cause an inflammatory response in the lungs, and that's going to cause that your alveoli are going to fill with all kinds of bad stuff. And by thickening the lining of the alveoli, either you could fill it with mucus or water, any other types of fluids. It makes it hard for there to be good oxygen exchange. And so you can literally drown in your own mucus and water, um, if and it can be treated very simply. If this is a bacteria causing this or a fungi or a parasite, we can normally treat it with an antibiotic. If it's a virus, though, we have to find specific antiviral medicine that are very effective in this very specific spot. And so, again, you're looking at these types of symptoms, which include all upper respiratory problems. Okay. So just make sure you have those four good. Hopefully, this is kind of a timely information for you.